contraction or retraction. So I'm going to have her prone, and her arm can be off the table, like at 90 degrees of abduction. You can scoot over to your left a little bit, there you go. And then again, you're going to be palpating. You can also stabilize her to kind of make sure she's not rotating too much when she tries to lift that. So you can kind of stabilize her here on the contralateral side, but then you're also going to use his hand to palpate in a minute. So to see for retraction, you're just going to ask her to raise her elbow up towards the ceiling. And if she retracts and you see kind of and feel a contraction of the mid traps, then that would be at least a 3. So now I'm going to ask her to do that again, and I'm going to apply pressure. Now the book, it doesn't make it really clear where the pressure is being applied, but in one picture they're applying it more closer to the glenohumeral joint to take the muscles of horizontal abduction out of the picture. So they're trying to take the glenohumeral muscles out of it and just focus on the scap. So if I kind of give her pressure more up near the joint, hold, and she holds, that would be a 5. And then you can scoot over just a touch. Now do that again, and if she holds, and the scapula breaks out of retraction, that would be a 4. Do that one more time, and if I tried to give her any resistance, the scapula just goes out of retraction. That would be a 3. And then a 2, again, here you're taking the weight of the arm. So without the weight of the arm, I can hold her here and ask her if she could squeeze her shoulder blades together. And she does. I see that it retracts, and I'm even palpating here, the kind of in between the thoracic spine and the vertebral border, and I can feel a contraction. So that would be a 2. And then a 1 would be she squeezes, I take the weight of her arm, and I ask her if she can retract the scap or squeeze it, and it doesn't really go into retraction, but I can palpate and at least feel the muscles are trying to contract. So I can feel a contraction. That would be a 1. Contraction, but no real movement of the scap with me taking the weight of her arm. And then a 0 would be just, there's nothing. Okay, so that's retraction. Okay, so we did elevation, protraction, retraction. Now we're going to do depression of the scap. So this one again, she's going to have her arm up here at about 120 degrees or so, about 145 actually, with her thumb pointing up to the ceiling. And then, again, her scap, you should see it depress when she raises her arm up to the ceiling. So go ahead and raise your thumb up to the ceiling. And you don't see a whole lot of movement, but you should see the scap depress a little bit. Okay, good. And then go ahead and relax. And so now, if she's done that, she's a 3. So now we need to give some resistance. And just kind of spoiler alert, a lot of times it's going to be hard to find people who are a 5 in scapular depression.
What muscle, can you guys name a muscle that would be?
Lower trap.
Lower traps, yeah.
So now I'm going to ask her to go ahead and raise her arm up. And I'm going to apply resistance at the distal part of her radius and on the hold. And my resistance isn't really hard because this is a long lever arm and these muscles just aren't super strong. So you're going to apply resistance at the distal end of the forearm. So go ahead and lift up again. We'll try that one more time. Lift up. Hold. What would you say she is there?
4.
4, yeah, because she kind of broke. So I would say she couldn't be a 5. She's probably a 4. Okay. Now a 3, we've already seen, she can raise her arm and the scapula does depress. For a 2, I'm again going to take the weight of the arm. So if I take the weight of her arm, I'm at least going to ask her, I'm going to palpate here in the lower traps, and I'm going to ask her to, again, try to lift her arm up. And when she does, even though I have the weight of her arm, see the scap depress and I can feel a contraction. So relax, so that would be a 2. A 1 would be, I ask her again, try to lift your arm up, and I don't see any motion in the scap. It doesn't depress, but if I'm palpating, I can at least feel a contraction. And then a 0 would be nothing. Okay.
Peggy, what angle did you say the arm starts at?
145. The book says that if the person cannot get up to like 145 because of restrictions in their glenohumeral joint, then you really cannot truly test lower traps or depression of the scap. Okay? So I think that's it.
Yep.